Hello friends, in the last class we have learned about the indications of micturating cystourethrography. Now, in micturating cystourethrography, we will see the procedure of doing this micturating cystourethrography. Here a contrast media is given to the patient, and the contrast media used here are mainly water-soluble contrast medium are used. In micturating cystourethrography, water-soluble contrast media are used, which contains mainly we can use Conrad 280 or Trivideo 400 or Eurographene 60 are used. All these are actually used as in the ratio of contrast is to normal saline ratio has 1:3. So in micturating cystourethrography, these are used in 1:3 ratio. Contrast is to normal saline ratio has 1:3. Now procedure. In micturating cystourethrography, first and foremost, we will have to catheterize the bladder. So here catheter is introduced into the bladder first. In micturating cystourethrography, catheter is introduced into the bladder. Then number one. And if it is a child, okay, in case of child, 5F feeding tube is introduced. Feeding tube is introduced with side holes. Is given for children. In older children, we can also use instead of catheter, like Ral's tube, instead of catheter, urinary catheter, we can also use 8F or 10F polyethylene, or soft rubber catheters can also be used. So we can use either 8F or 10F polyethylene or soft rubber catheter can also be used. And these soft rubber catheters are used with holes, with end holes can be used. Okay, so these are introduced into the bladder. And then in girls, actually one important thing is you should look for any genital abnormalities. If the child has any genital anomalies or abnormalities, we should note them. Okay, and then urethral catheter is introduced in a girl. Urethral catheter is inserted. Now, when the bladder, first, when you are catheterizing the bladder, so when catheter enters the bladder, you will see the urine flowing through it. Urine flows through it, so this is observed. So this can confirm that the catheter is in bladder. If the catheter is not in bladder, then generally urine cannot flow through it, right? So whenever urine flows through the catheter, then you can confirm that the catheter enters the bladder. So if there is no flow, so that means catheter should be advanced. You should introduce the catheter more, so that it should be advanced till urine is obtained. Until urine is obtained, you should advance the catheter in this if there is no flow. Okay, even if there is no flow, sometimes you can also apply, sometimes in the baby, sometimes you can also apply suprapubic pressure. So when you apply suprapubic pressure, you can see the small urine, suprapubic pressure, you will see that urine might come out, or urine flows through the catheter. Okay, now if there is no urine is obtained, then catheter may have been introduced into the vagina in a female child. That is one thing you should see. Before introducing the catheter, obviously you should lubricate. So catheter, before introducing the catheter, you should lubricate it with jelly, anesthetic jelly. You should lubricate it with anesthetic jelly and then introduce the catheter. The catheter is introduced in males by retracting the foreskin, and then you should also hold the penis gently in vertical position and then insert the catheter. Then, once you have inserted the catheter, one important thing you should know is the bladder capacity of the babies. So, normal bladder capacity in children, you can calculate the normal bladder capacity in children can be calculated like this. That is age in years into 2. This will give the normal bladder capacity in ounces. The normal bladder capacity in children can be given as age into 2, and this will give as ounces. 1 ounce is equal to 29 cc. This is one thing which you should remember. Next, if you see normally in newborns bladder, almost 30 to 50 cc is instilled with ease. Easily you can insert 30 to, you can inject or give 30 to 50 cc of fluids to the baby into the bladder through the catheter. Then from about 3 years, if you see, girls can hold up to 200 to 250 cc, and from 12 years it is even more. Whereas if you see in boys up to 5 to 6 years of age, the capacity is 100 to 150 cc, whereas in older boys, the boys can retain up to 250 cc. So when the adequate capacity, when this much amount of fluid is given to the child through the urinary catheter, then the child feels uncomfortable and starts to void. So when we give the adequate capacity of fluid, if this adequate capacity of bladder is reached, that is when the child starts micturating. Now the child will void or starts micturating, voiding around the catheter. Now, when do you filming? So this is done. Now you will have to start filming. So in filming, if you see, first, in children up to 2 years of age, if you see in children up to 2 years of age, you can fill the bladder by hand injection, by injecting it through the hand itself, you can fill the bladder. Okay, because the child is just 2 years, so if you see 2 years, it is less than 200 only. In newborn, 30 to 50 cc, so obviously it is filled by hand injection. In older children, that is more than 2 years, you can fill it by a bottle, elevated. It can be filled by using a bottle, just like saline. How do you give the child or give the patient saline? Similarly, you can fill it by a bottle which is elevated 1 meter above the table. Now, during filling, fluoroscopic screening should be done. During filling also, you should do a fluoroscopic screening is done. Why? Because the main reason of this fluoroscopic screening is to see if there is any vesico-ureteric reflex or any diverticuli or any other abnormality which was found. Then the child is then turned oblique on both the sides so that the minimal reflex is not overlooked. Because if we do not turn the child obliquely, minimal reflex may be overlooked. Then, if reflex appears at any position, okay, if there is vesico-ureteric reflex appears, then always films are taken in oblique position to make sure that this won't be a problem. Okay. Then, followed by this, if the bladder appears normal, if the bladder is normal, then one film is taken in frontal position. One film is taken in the frontal position at the end of filling. At the end of filling, one film is taken at frontal position. Then, once the catheter is removed, once you remove the catheter, once catheter is removed, then the child will start voiding. Once the catheter is removed, child starts voiding, and at the end of the voiding, you will see a frontal film is taken, and this frontal film is taken, and you can see the kidney region also. So this frontal film is taken complete abdomen to see whether there is to see the obstruction or if there is any issues in the urinary tract. Then next, what about adults? In micturating cysto-urethrogram in adult male, if you see the procedure, it is similar to that child. You should this micturating cysto-urethrogram is similar as an older child where voiding filming is done in both oblique position. Okay, now the main important thing in adult male is that the voiding in adult male can be modified by getting the patient to void against resistance. You will have to ask the patient to void against resistance. How? This void against resistance. This resistance can be given by either compression of the distal part of the penis. You can either ask the patient to compress the distal part of penis, or we can also use a penile clamp, either by compressing the distal part of penis or by using a penile clamp. We can ask the patient to void against resistance, because here voiding is done against resistance. Why? Because this will increase the visualization of urethra. If the patient voids against resistance, this will increase the visualization of urethra, and this procedure of voiding against resistance is called as Chokes cysto-urethrogram. This is called as Chokes cysto-urethrogram. Then, if you see in adult male, in adult female, the procedure is similar to that of girls. Okay. Um, so here film is taken at rest, one film is taken at rest, and one more film is taken during training. So that is the only difference. Apart from that, everything else is similar to girls. Now, what are the complications of micturating cysto-urethrogram? The complications of micturating cysto-urethrogram is that first there is danger of infection, because we are catheterizing the bladder. Infection can pass through the bladder through our catheter. If it is not sterile, then it can result in infections. Here, second, we are giving contrast medium to the patient through the bladder. So, through the catheter into the bladder. So, this can result in some side effects, because this complex medium, complex contrast medium can undergo absorption, or it can be absorbed into the blood, which can result in some side effects. Then, then the patient can also develop one more complication, which is called as autonomic dysreflexia. Actually, this autonomic dysreflexia is seen in paraplegic patients. That is, whenever there is spinal cord injury. First of all, if there is spinal cord injury, either at the level or above, at the level or above the level of T6, if there is any spinal cord injury, then the patient will suffer paraplegia. Here, in these patients, if you give forcefully, if you give contrast, if we give the contrast injection forcefully, then the patient can develop headache, or the patient can develop sweating. All these are autonomic manifestations. or increased hypertension or bradycardia can develop in these patients. This is called as autonomic dysreflexia. So this can be treated. The treatment of this autonomic dysreflexia is here. You can either number one relieve the bladder distension, because here we are distending the bladder, so we can relieve the bladder distension, or you can also give a drug which is diazoxide, can be given in the dosage of 3 to 5 milligram per kg of diazoxide can also be given. So this is about autonomic dysreflexia. Then the other complications. There are some complications which can occur due to wrong technique or some amount technique usage. So if you see, the child may develop acute urinary tract infection when the infection gets into the bladder through the catheter. With the catheteric trauma can also occur. Catheter trauma can occur. Whenever there is catheter trauma, the child may develop dysuria or frequency hematuria or urinary retention can occur. All these can occur due to catheteric trauma. Then there can be complications of bladder filling, like there can be perforation of the bladder by the catheter or by over distension. Okay, then there can be other complications, like there can be retention of the Foley's catheter can also occur. So we will have to puncture the Foley's bulb through the radiologically through ultrasound, or there can be radiation effect also, because obviously this is an X-ray, right? So this is here the gonads are being exposed to the X-rays. So whenever the gonads are being exposed to the X-rays, this can result in some carcinomas. To make sure that this gonads are, so the exposure to X-rays is kept mostly by minimum. So this is about micturating cysto-urethrogram. Thank you.